This past January, the vaccination debate, sometimes quiet but never calm, got a shot in the arm in the form of the Disneyland measles outbreak. Immediately, those who were unvaccinated by choice were targeted as the weak link in this outbreak, and both our media and our legislatures pondered potential solutions. But can this complex debate be reduced to an us versus them argument, with one side right and the other necessarily wrong? To help lend some context and discuss this issue with me today is Dr. Richard Moskowitz. Dr. Moskowitz graduated cum laude with an undergraduate degree in biochemical sciences from Harvard University, received his MD from New York University, and has been a practicing homeopathist in Watertown for some 4 decades. He has researched, thought, and written on the issue of vaccination for almost as long. Welcome, Dr. Moskowitz.
Thank you, Peter.
Thanks for joining me.
It's a pleasure.
I should say up front that the motivation for my inviting you today was this: that the vaccination debate, as it's discussed in this country and in our media specifically, frequently, is very polarized. On one side, we have the medical community that supports vaccinations as a miracle of modern science and safe and effective. On the other side is an ill-informed, fear-rattled, and selfish group of parents who are imperiling otherwise vaccinated community. The territory that isn't typically considered is the middle ground between those two extremes. The scientific, medical professional who may still question some issue or some part of vaccine policy. And I take you, from my read of your work over the years, as somebody who does that. So welcome for contributing to the conversation at that level. I need to quickly provide just a little bit of background to the Disneyland measles outbreak. January 7th, this past January 7th, it was announced that a visitor to the park, who best estimates suggest had visited the park sometime between December 15th and 20th from a foreign country, was linked to 9 confirmed cases of measles. 93 cases have since been connected to the outbreak. Significant time and resource has been devoted to the tracking of potential carriers across numerous U.S. states, as well as Canada and Mexico. Although it's next to impossible to arrive at a reliable number of the vaccinated or unvaccinated from media reports that I've read, coverage implies that a significant majority of the ill were unvaccinated. The bulk of news stories have since blamed anti-vaxxers, as many of the sources label them, for failing to vaccinate their children and thereby increasing the threat of disease spread to the general population. Bills are being written, likely as of today, in a number of states to limit parents' ability to exempt their children from vaccination for all reasons but medical necessity. So here's the question, after that long introduction. Do you regard all of this activity and alarm as an appropriate response to the measles cases we've been seeing over the past 2 months?
No, I don't.
And why not?
Well, first of all, this outbreak is no different from many outbreaks that have occurred since the vaccine was introduced in the 60s, where there are a few dozen or at most a few hundred cases that appear from time to time. And you know, the interesting thing to me is, why don't they say exactly how many of those cases had been vaccinated or not? Mm-hmm. It's very easy to come by that information, and I'm sure that the health departments have it, but they very rarely disclose it. And it seems clear that one of the reasons is that in most, if not all, of the outbreaks that I have studied, the vast majority of the cases are people who have been vaccinated. Mm-hmm. So that brings up a quandary to me. Because if the vaccine were as good as it claims to be, if it really gave genuine protection against the measles, then what is the problem? Then the unvaccinated kids would be a threat only to themselves. You can't have it both ways. What that really says to me is what we already know, if we think about it, which is that vaccination does not confer a true, genuine immunity. If I were a proponent of vaccination, I would say let's declare victory and go home. So there's a few hundred cases here and there, but you're not going to get any better than that. It has an attack rate of close to 100%. That is, it's one of the very few infectious diseases that if you're exposed to it and you've never had it before, the chances that you will come down with it are close to 100%. When a population is exposed to the measles for the first time, like when Cortez brought it to the New World and the Aztecs had never encountered it before, it decimated entire villages. It would kill, you know, at least 20% of the people who were exposed to it for the first time. It was a killer disease. But over the centuries, we had evolved basically a way of dealing with it such that it was considered a normal disease of childhood, in the sense that, yes, there were still some deaths and some serious complications, but they were rare comparatively. Almost everybody caught it. Almost everybody recovered from it without complications. That meant that not only would I never again get the measles, no matter how many times I were re-exposed to it, no matter how many epidemics were raging around me. That's specific immunity, very important. But even more important was the non-specific immunity, which nobody talks about, which is that my immune system had responded to the disease with a magnificent outpouring of the entire immune system, of every component of that, which includes serum proteins, it includes serum complement, it includes antibody formation, such that my immune system was primed and ready to respond acutely and vigorously to whatever else would threaten it in the future. And indeed, I regard my own health now, 70 years later, my own good health and relative freedom from serious infectious diseases, as in no small part due to the fact that I was able to come down with and recover from an acute disease like that. It's like a graduation ceremony for my immune system. What I take from that is that the purpose, the mission of the immune system is to learn how to respond acutely and vigorously to infection. That's natural immunity. It's absolute, it's lifelong, it's permanent. Artificial or vaccine-mediated immunity is, in a certain sense, counterfeit, that it's a trick, that we take a certain component of the immune response, namely the production of antibodies, and we produce that artificially by introducing either an attenuated virus that's still alive, as in the case of the measles vaccine, or a heat-killed or otherwise denatured version of the original bacterium or virus, as in the case of the Hib or the pneumovax. And we add some kind of adjuvant to it, in the case of the non-living vaccines, that will bind it to the cells of the immune system for a long period of time, such that there's really no way to get rid of it exactly. Where does it go? You see, this is what troubles me, because what we're talking about there is a chronic phenomenon. The measles, the natural measles, is an acute phenomenon. That's the programming of the immune system. And my clinical experience strongly suggests that by introducing a vaccine into the human body and binding it to the cells of the immune system without providing any method of expelling it, which after all, the disease measles is precisely the successful attempt of the immune system to expel that virus from the body, period. By introducing a vaccine and keeping it there inside the body chronically for a long period of time so that it will continue to make antibodies continuously throughout the life of the patient, we, I believe, have changed the programming of the immune system such that we not only respond chronically to the measles, but we're responding chronically to other things.
Can we shift from and valuable terrain certainly to cover, but from how vaccines conceivably operate in us to vaccine policy and the notion of mandates?
Yes, indeed.
So certainly the argument that I find very potent, that our doctors and our medical community and public health will argue, is we have to consider in vaccine policy the elderly, babies too young to be vaccinated, people who are immunocompromised. How do we balance the idea of individual health concerns, legitimate certainly on their own, with the responsibility we have to a wider community, and need those two concerns be mutually exclusive? Can we hold both and make sense of both,
I think
taking
so.
whatever position?
I think so. The one about the babies too young to be vaccinated is really interesting because, you know, one of the benefits of absolute immunity, of natural immunity that I was just describing so eloquently, is that the mother's milk would contain the antibodies that the child would need to protect it until such time as its own immune system was able to kick in.
Were she to have contracted the disease naturally?
Yes,
right?
exactly.
Okay.
And now those antibodies are no longer there. That's a good example of what I mean by the fact that the immunity conferred by vaccines is not genuine. So babies are now once again at risk of developing the measles. Not a good age group. Right. Because as I said, that's a disease for an older child where their immune system is already developing. So, you know, the advice that I give to a lot of parents is to stall off the vaccines for a while, to let the immune system begin to develop its normal acute programming, to develop fevers, for example, and to recover from them.
Well, I can't thank you enough for joining me today.
Sure.
I hope that we began to stake out that middle ground that I was hoping for.
Me too.
And I hope that viewers can take away, I think, the insight that offers, that we can try to see both sides a little bit differently as a result.
Well, thank you. I hope so too.
Absolutely. Thank you.
Thanks, Peter. It was a pleasure.
Thank you.
I enjoyed speaking with you.
Need vaccination be an us versus them issue, with one side right and the other necessarily wrong? Might all sides have not only their blind spots, but also claim some measure of wisdom and insight into a complex topic that will be with we humans as long as we remain mortal? On behalf of Dr. Richard Moskowitz, I'm Peter Bermudez for Arlington Public News.